I'm Dr. Ryan Francis from Grove Health Dental, and today we're talking about dental trauma, or tooth trauma. So there are several scenarios here that we could discuss. So the first one being, let's just say little Johnny is out at the hockey rink and boom, his tooth comes out. Full tooth comes out. Probably not sure if it is a baby tooth or a adult tooth. So the key here from this is timeliness. If that full tooth is out and it is a clean tooth, we want to get that tooth back into the socket within 5 minutes. Now, if it's dirty, we want to clean it, rinse it out with water. Hold it by the tooth part, not the root. If you're comfortable with it, you want to re-implant that tooth and just have them bite down on something and come see your dentist. So most of the time, the child will probably not want you to do that. So the key here that I want you to take from this lesson here is if a full tooth comes out, you want to clean that tooth and put it in some form of a storage medium. Now these can be anywhere from milk, saline solution or contact solution, or something called Hank's storage medium, which I'm assuming not many of you carry that around with you. So odds are when a tooth comes out, you're not sitting with a glass of milk with in one hand and contact lens solution on the other. So another option is simply your saliva or spit. So that tooth comes out, you want that clean. You can spit into a cup, preferably the person spit who lost a tooth. Cover that and call the dentist. Again, time is of essence. So as long as that is in some form of storage medium, meaning the saliva, the saline, the milk, you have a bit more time, more along the lines of hour, 2 hours of actually being able to still salvage and save that tooth. Now if it's a baby tooth, we're not going to put that back in, but again, sometimes mom and dad not sure if it is a baby tooth or adult tooth, so we can kind of walk you through that if indeed you're not sure what type of tooth it is. So now if a tooth is damaged and it's still in the socket, again, we want to see that child or you, whoever it may be, ideally less than 24 hours, okay, because there are certain procedures that we can do to increase the longevity and the likelihood of us being able to salvage that tooth. Even if it's just a slight bit loose, we want to see you because we can splint stabilize that tooth. That will potentially be able to keep that. Now, it's likely that that tooth is going to need some treatment down the road, and the only way of knowing that is you coming in periodically and monitor that. Dental trauma, we don't know if that tooth, if you get hit and that tooth is loose, hurts, sore for a while, and it gets better. Well, that could be better for a month or 10 years. We don't know when that tooth is going to eventually give you problems. The chances are, though, it's a better chance that it will give you some form of a problem down the road. So dental trauma is kind of a lifelong issue that most people have to deal with. Usually ends up needing a root canal, but that is a better scenario than having to lose the tooth. So the key points again I want you to take from this are if the tooth comes out, you want that clean and get it into some form of a storage medium as soon as possible, because that will vastly increase your chances of being able to save that tooth. So thanks for listening. We'll have some references and summarize what I was talking about at the bottom of this blog. So thank you very much.